Hello and welcome to Askimo TV. I'm talking today to Dr. Feilim Murphy. Dr. Murphy is the clinical lead for Paediatric Surgery and Urology at St. George's Hospital, London, specializing in undescended testes and incontinence. Hi, Dr. Murphy. How are you?
Not too bad. Good morning.
Dr. Murphy, let's talk today about the umbilical hernia. So what is a hernia?
Well, a hernia is an abnormal protrusion from one part of the body into another area. So you can have hernias within the body, from within the abdomen into the chest, or from within the abdomen coming out. So an umbilical hernia is a little hernia that pops out at the belly button.
What causes a hernia and why is it a concern?
Well, because an organ or part of an organ within the body is coming out through its surrounding capsule, it's basically breaching the boundary, and therefore it can get caught, it can get strangulated, to use a technical term, and some of the blood supply can be impacted. So it is a problem in a small number of patients in which the hernia gets stuck within the opening.
Who's at risk for developing an umbilical hernia?
Well, umbilical hernias are quite common in babies. It is a group predominantly that it's not unusual for little babies to have an umbilical hernia. It's more common in people of African extraction, and also common in a small group of patients who have what we call anterior abdominal wall defects. So these are children that are born with an abnormality of their tummy wall, where the musculature is not entirely normal, and they have a large or abnormal defect around the umbilicus. But the vast majority are normal children, perfectly well and healthy, who have a small little defect where the umbilicus, so at the belly button, where that little defect has not closed.
How does the umbilical hernia differ from the inguinal hernia?
So an inguinal hernia is a hernia that's down in the groin itself, so in a boy just above the testicles. An inguinal hernia is where, in the male, that's where the testicle has passed down from inside the tummy out into the scrotal sac. And they are quite a common type of hernia, particularly in preterm male infants. And they are much more likely to get strangulated or the hernia to actually get caught within it. Umbilical hernias are a hernia of the belly button itself. So it's right there, obviously where the belly button is, and they rarely get strangulated.
How are the hernias diagnosed and what treatment options are available?
Well, the hernias are diagnosed in young children very simply because the parents go, well, what is this round swelling in my child's belly button that comes and goes? It usually gets bigger when the child cries, and the parents would believe that it's causing them distress, but they very rarely cause distress in small children. What happens is, as the child's crying, as babies always do, the hernia is pushed out more through the little umbilical defect, and it appears much bigger and appears shiny and red, but the vast majority of the time it will just disappear back into the tummy itself, and it's not a concern. So the parents spot them quite easily. They bring them to the surgeon, and the surgeon's duty really is to make sure that it is an umbilical hernia. There are some other defects that can occur in the midline or near the umbilicus, which don't tend to resolve as quickly as umbilical hernias. And it's important for the surgeon to differentiate that from the other types of hernia.
What treatment do you use to treat the umbilical hernia?
Well, the good news is the vast amount of umbilical hernias actually go away by themselves. But if they haven't resolved really by the age of 2 to 3, then we would talk about closing them. The majority of them don't cause any complications. It is one of those things in which they rarely get obstructed. I've never actually seen an obstructed one, though I've heard some myths that it does occur, but it is literally that rare that they would become obstructed. So therefore, leaving them is very safe in the majority of patients. And then when they're a little bit older, they haven't gone away by themselves, they can easily be closed.
Thank you, Dr. Murphy. Thank you so much for talking to me today.
Not at all.